Yep, it's that time. Welcome back to Morning Break. And this week's Monday Motivations is brought to you by Gates Brain Health. Dr. Randall Gates is a board-certified chiropractic neurologist and chiropractic physician. We're talking about Parkinson's disease today, Dr. Randall Gates. Thank you so much, first of all, of being here today.
Yeah, nice to meet you finally, Carly.
Yes, happy to do this interview with you. So what is Parkinson's disease? What does that look like?
Parkinson's disease usually looks like a family member may notice a little tremor, specifically at rest. So a lot of people can have a tremor like if they're holding a glass, but specifically with Parkinson's we see a tremor at rest. There might be a slowing of movement, which may just mean blinking less often or having difficulty making a turn. Those are the characteristic symptoms that individuals will have.
Okay, and so who does this, or how common is it, and who does it mainly impact?
It becomes more common as we age, so around 55 to 65, I think it's 1% of the population, but by the time somebody's 75 to 85, it can be upwards of 4% of the population. More males than females, but it's not that significant of a difference.
Okay, and then what does treatment look like? How do people go about getting standard forms of treatment? Yeah,
so typically a general practitioner usually will identify, that something is changing. They refer to a neurologist. A neurologist usually does an examination. Parkinson's still is a clinical diagnosis. And so then they may start an individual on medication. Usually it's called levodopa, carbidopa, or Sitamet.
Okay.
And then they'll titrate that person up. They'll see if there's an improvement in their motor symptoms, i.e. does their tremor become less? Are they able to move more fluidly? And that's the standard treatment.
Okay, and if to those folks at home, I guess, what do you look out for, those first warning signs? I know you mentioned the tremors, but is there anything else?
Yeah, one of the other symptoms that's common is like getting stuck in a bathtub. So if somebody's having trouble getting out of a tight space or a bathroom, that's really when you want to pique your curiosity that something might be going on. Or they're moving slowly, their handwriting is changing, so their handwriting can become really small. Those are common symptoms.
Okay, and then what treatments do you guys practice? What does it look like for you?
So I'll circle back to that. I do want to say that there are new medical therapeutics coming out all the time, so that is exciting for the Parkinson's community. There's now inhaled forms of dopamine. There's a new patch on the skin. Because one of the main problems with Parkinson's is that the on periods, as we term them, from taking the medication can become shorter and shorter. And so that's where other medication-based approaches lots of times are utilized to help give that person more functionality. Deep brain surgery is also now having a lot more success than it was 20 years ago. That's another option. But circling back to what I do, because I see a lot of people who are having these symptoms and not feeling as well as they want to, even with taking medication. I work with their diet because Parkinson's we actually think starts in the gut for the vast majority of individuals. That's where the nerve degeneration, you can think of it, starts. And so then they can get overgrowth of bacteria, and that can then think of it as like poisoning their brain. Not literally, but that's the net effect. It's called metabolomics. I also use a lot of antioxidant supplements with patients with Parkinson's. It's actually quite interesting, some of the changes we've seen, as well as brain exercises, trying to activate the areas of their brain that are not firing as well as they should. So nothing is a cure at this point, but I've seen a lot of Parkinson's patients have some assistance.
So with that diet, can we talk a little bit about that and what you've seen with patients? How do you change their diet? What does that look like?
It depends on the individual. Lots of times carbs might become an issue simply with them. So that can be an issue. And also because it starts in their gut, their motility slows down. When your motility slows down, then you can get overgrowth of gut bugs.
Okay, I see. I feel like gut health has become such a prominent thing that people are focused on. And
that's why we have that, homage to the person who created that logo. Yeah, but that's why we have it there, to really show how the gut feels the brain.
It really correlates. Anything else you want the community to know? Maybe the folks at home who are dealing with Parkinson's disease, how your practice can help.
Yeah, absolutely. We do free consultations. So if you're interested and you're just kind of struggling with not improving the way you want to or managing the condition, we do free consultations. You can call us 775-507-2000, and we'll look at your case and see if it's a good fit or not. So.
Awesome.
Yeah,
Thank
that's what
you
I'd say.
so much,
Of course,
Dr.
Carly.
Randall Gates.
Yeah.
Definitely informative and great speaking with you about this and Parkinson's, because it's something that you may not even think about until it's too late.
Very
we'll
true.
have all that information on our website at kolotv.com. We'll be right back.